So something that's bothered me my entire career is that the largest supply companies give huge discounts to the large DSOs, while private dentists have to just pay more and more and more for things every single year. What's also bothered me is that there are some buying groups out there in dentistry that claim to save private dentists a bunch of money, but those buying groups are still utilizing the big companies that have been overcharging dentists the entire time. And those buying groups aren't necessarily giving dentists the low pricing that the DSOs still get. In comes a solution. A new sponsor of ours, I'm super excited to announce that the Private Dental Alliance is trying to solve this problem. Finally, someone's doing it, where private dentists only join their alliance and they get super low pricing on equipment, supplies, and lab fees, competing with the DSOs, putting them on a level playing field with the DSOs. If you want to understand how much money you would save, text the word savings to 48659. Savings to 48659. Do that right now, and you will be able to see very quickly a price comparison of what you're currently spending with whoever you're spending it with to what life would look like if you were in the alliance. Be a private dentist that takes advantage of this. Save a ton of money. Don't keep going month after month, losing money because you just haven't gone through the process of joining the alliance. That's Private Dental Alliance. Super excited. Finally, we can save some real money as private dentists. So it's a brave new world in dentistry right now. You've never seen a practice like this. You take x-rays and automatically AI tells you what's wrong, automatically creates a treatment plan, automatically charts restorative existing work, automatically has insurance benefits listed, automatically will create a claim and get real-time information back from an insurance company. And as soon as you cut that tooth, you automatically get paid. All of that happens automatically in a clean, accurate way. And what I'm describing, we're probably only months to years away from. And that is at the foundation what we're talking about in today's episode with the founder and CEO of Pearl, Ophir Tanz. He is not only going to kind of explain today's state of AI and how that's impacting day-to-day dentistry, but we are going to dive into what it's going to look like 6 months from now, 12 months from now, and ultimately how the face of dentistry will completely change, not just from a practice management standpoint, but also from the patient's perspective and the provider's perspective. And I'm super excited for this episode today on the Dental CEO Podcast. All right, again, Ophir, thank you so much for joining us on the Dental CEO Podcast. And I've got so many things I want to talk to you about. I don't even think we're going to have time for everything. I might need to convince you to join us again. But before we dive into that stuff, could you kind of just give in your own words kind of who you are and what you're up to, a few sentences just to kind of calibrate all the listeners and we're all on the same page?
Yeah, absolutely. It's great to be here. Thank you for having me. So my name is Ophir Tanz. Serial entrepreneur. I've started a number of companies, but really the common thread between all my companies over the past 20 years has been something called computer vision, which is teaching computers to see and interpret the real world. That technology has evolved immensely since I first got exposed to it back in college, and my last company prior to Pearl was also leveraging that technology very heavily. So I started that company in 2008, ran it until 2019. And in that period, we just saw an immense explosion in terms of capability. And now we're kind of in this AI, moment in history. So that's certainly helped us do a lot more than we were, previously able to do, just because the technology and the foundation models themselves have evolved so dramatically.
Yeah, and you mentioned that timeline. I remember when we were in my companies, we were working with IBM Watson, trying to get IBM Watson to listen to phone calls and to kind of assign data points to different things that were said, and then analyze those data points and learn from them to ultimately predict what we should be doing. And we called all of that, back then, machine learning. And that's kind of now evolved to, I guess, what we call AI. Did I say all of that correctly?
Well, somewhat. So, AI has a number of subcategories of which machine learning is one. There have been various attempts for the past several decades to bring AI to the fore in a way that is, functional, scalable, and cost effective. A lot of failed attempts, a number of AI winters, historically as well. And it seems like we have identified the magic, which is effectively driven by neural networks combined with effectively GPUs, these chipsets that are able to perform certain types of basic math at very rapid speed at scale, which is why you've seen, NVIDIA, for example, grow so dramatically. The history there is very interesting. Won't get into it overly, but effectively these chipsets were made for gaming purposes, and some folks had the insight to try and apply those chips to methodologies that actually date back to the 50s and 60s in terms of sort of the conception of the first neural network. And it just worked way better than anybody could have anticipated. And now here we are.
All right. Well, I'd like to dive into your story, and of course, you're the founder of, or one of the founders of Pearl, CEO of Pearl, and Pearl started as what I might call the most exciting company in dentistry on the AI front with radiological AI, and since then, Pearl has evolving and maturing into something just incredibly powerful for dental practice that I really feel is going to completely change the landscape of how we run medical and dental. But before we dive into that whole piece of it, I want to kind of get a foundation level of information on the radiological AI side of Pearl.
Yeah.
So if you could summarize that a little bit for me, and we can bounce back and forth on that to make sure that we get that across.
What's interesting about Pearl so far is that the market has adhered so completely to our original thesis about it. So when you start a company like this and these technologies don't exist, you have a certain thesis. So for example, one of those theses was that radiologic AI, the ability to identify pathology, existing restorations, other conditions, anatomical anatomy and segmentation, would become a standard of care. We surface 37% more disease on average per radiograph encountered. And we have also created a very effective, very clear patient communication tool so that you can have a visual conversation with the patient in a manner where they actually understand the radiograph very clearly and very deeply. And now, 6 years on, I think we are seeing that this is rapidly becoming a standard of care. We're in a mass adoption period globally for the technology. The larger thesis was that dentistry started in an analog state. It's moved to a digital state, as we know, with the advent of digital dentistry. But that never really, it never really contributed or delivered on its full promise. And the reason for that is everyone's now sitting on mountains and mountains of digitized data, but there's very little that you can do with that data because there's just a massive quantum of it. And without the ability to leverage technology to actually understand what's in that data and understand the oral health state of patient populations at scale, you're just very limited. So now we're in a new phase, which is where we're seeing a cognitive layer being infused into all aspects of the category. And that's really the central role that Pearl is playing in dentistry today. Yes, there's the radiologic AI component, which we refer to as a Keystone technology. And the reason it's a Keystone technology is once you could understand patient populations at scale it enables you to engage in just so much interesting work from an automation and an efficiency perspective. So, our view is that if you look at a PMS today, for example, it's a heavily manual interface that you are interfacing with, right? Because you're putting in your schedule and you're doing charting and you're doing clinical notes and you're doing a bunch of claims assembly and insurance certification eligibility. And that's all sort of making its way into the PMS. And it's our view that pretty quickly, we're going to see that entire layer be automated away, and we're going to return hours a day back to a practice. So we do, for example, a donogram auto charting. We do AI-driven treatment planning. So we'll actually look at the radiologic output from an FMX, say. We'll look at the patient records and we'll recommend a treatment plan, obviously for the practitioner to interface with and modify as they see fit. But then we write all that information back into the PMS. So you just see a huge amount of efficiency gains, and you also see the PMS, which is a system of record, becoming just much more pristine in that regard. We also have a thesis for how that's going to affect what we call the output layer. So you're putting a lot of data in the PMS, that'll be automated away. The way that you get data back out of your practice is also a bit archaic, right? You're dealing with typically legacy PMS systems and you're trying to pull information about your practice out. And we're also creating a layer of intelligence that we call Practice Genius. We haven't launched this yet, where interfacing with your practice data will be much more like a visual ChatGPT, where you have a series of agents working on your behalf to develop insights and recommendations about your practice, analytics, reporting, and also an interface you can ask questions of it. So I think the entire paradigm of the heart and soul of a dental practice, which is kind of the PMS, it was going to continue to exist as a system of record. But we are going to add significant intelligence into that layer. And I should also mention the imaging system is inclusive of that.
All right, I'm going to need to unpack a whole lot of what you said here, if that's right. But and by the way, for those of y'all listening, and especially if you're listening from another country, like PMS, that's practice management software. That's like how we store our digital records, our charts, and our notes, and things like that. Okay, so it seems to me when I listen to you say this, first of all, the pure form of doing dentistry, finding the dentistry, doing it, and getting paid.
Yeah.
There's so many things that erode away the efficiency of those acts that in the old archaic way we had to deal with. And it was even more archaic when we didn't have the data digitized. So we couldn't even know of the inefficiencies. We couldn't even pull reports and get new functions kind of inputted in to do things like follow up with unpaid bills or unscheduled treatment.
Yeah, my father, by the way, was a dentist. He's retired now. But I remember going into the dark room with him and processing films and the reams of file cabinets and all of that. So I also remember when he transitioned to digital. But anyway, continue.
So every moment, so if you think, okay, we advertise for a lead, the lead comes into a phone call. That's a moment of erosion. We miss some of those calls. We don't convert some of those calls to appointments. Then we schedule them, and maybe we schedule them inefficiently. There's another point of erosion. And then we try to confirm them, and we try to get them to show up, and some of them aren't confirmed properly. They don't show up. There's a communication gap. We have erosion. Then they come in, and we take poor x-rays. We don't even realize how poor they are, and there's erosion. We don't diagnose things. There's erosion. Yep. Or we diagnose it, but the patient doesn't understand it. Another piece of erosion. We don't get financial case acceptance. We don't create the claim properly, but we don't even estimate the money properly because the verification of benefits was done incorrectly, or the data was put into the practice management software incorrectly by our team, and that's their habit. And all of these moments create an erosion away of efficiency and money. So in other words, things take too long, and we undercollect. In essence, the end result of those things is undercollecting.
Yeah,
so
beautifully said. I totally agree.
So what I'm hearing you say is through the process of building out at first Radiologic AI, you have now kind of started this journey as a company that leads down a lot of different AI enabled or automation based solutions that take away this friction or erosion. Did I say that correctly?
Yeah, that's a really nice description, and that's exactly right. So once you have um, the radiologic AI active in a practice, it just, like I mentioned earlier, opens up the door to significantly less erosion, to use your terminology. So suddenly you can automatically chart the odonogram on behalf of the practice and write it back to the system so that you know that that is being done consistently and in a high quality manner. You could treatment plan. What's another thing that you can do? The one of the things that I'm most excited about today is around the RCM component. Um, and this is maybe one of the few areas where payers and providers agree. And we are, just to be clear, an extremely provider centric, provider friendly, provider focused company. We have left a lot of money on the table, to be honest, as an organization by virtue of not wanting to service certain payer needs and desires around claim denials. But what we are now bringing to market is the ability to real-time adjudicate claims in a very intelligent way at the level of the tooth. We're able to service likelihood of approval or denial, and then actually just fully adjudicate on that claim on the provider side.
I'm understanding what you're saying, but I think that we need to explain
Yeah.
some of these things for the listeners. So, what we're saying here is, and stop me whenever I haven't said it correctly, but what I think we're saying here is, I take X-rays, and Pearl will tell me those are good enough or not. Retake it because you have a problem over here. Pearl automatically, through its learning, through its AI, knows if that's a diagnosable X-ray or not. So I retake the X-rays, so now I have clean X-rays. With clean X-rays, Pearl can highlight areas of potential diagnosis: bone loss, periapical radiolucencies, decay, all the way into what eventually becomes 3D dental radiology or analysis, right? And if we can highlight that, that means we can also tell what the patient already has existing, like in their mouth. And that data can be what you called written in, right? So in other words, we can chart the existing. We can chart the decay and the bone loss, all without manual input, potentially. In addition to that, we can create potentially a claim and in real time know how much is going to get paid on it, right? So if a patient needs an MOD because they've got decay, we can, instead of having to do the old fashioned way of trying to figure out what the benefits are and what's paid and all that, we can in real time, hypothetically, click, they need an MOD, or we're not even clicking, right? The software is automatically telling us, send it to the payer, send it back in a split second and say, yeah, the payer agrees you need an MOD, highly likely, and you would get paid this much, and so the patient would owe that much.
Yeah, and actually it's even a slight step further, which is we have such a significant level of agreement, say for approvals with a payer over 99%, such that they just say, okay, we're just going to tell you it's approved. We're going to give you an approval code, and you don't even need to send us the claim. We just approved it. It's just that whole workflow is gone. Everyone's super happy because of that. The patient is totally informed. They're able to make a decision while they're still in the chair that is financial in nature, as well as obviously related to their oral care. The practice has a lot less overhead and this opportunity to kind of fumble on the claim submission and deal with it with the payer on the back and forth. And then the payer also benefits because now they have just less overhead. So it really is kind of a holy grail opportunity that everyone, I think, has dreamt about for a long time, and now it's becoming a reality. You also mentioned, interestingly, two other things, which is we have a product called Image Check. So as soon as a radiograph is captured, we identify if it's diagnostic or not. If it's not, we tell the practice why and how to rectify the situation. And in many cases, we're able to just use AI to enhance the quality of the radiograph to make it diagnostic. So what we're doing there is making sure that 100% of the radiography that's captured is diagnostic, which just helps everyone for a lot of reasons. And we'll typically find when we go into a practice, we'll run a report. We'll say, hey, 21% of your radiography is not diagnostic. Here's a report. Here's the operatory. Here's the sensor, and here's why. And you also mentioned 3D. We are the only company in the United States with both 2D and 3D FDA clearance. So everything that we were talking about in the 2D realm extends also to the 3D realm now. And that is, I think, going to be a real unlock for the industry because CBCT, right, 3D captures are a little bit daunting and overwhelming for a variety of reasons in terms of interpretation. They're often sent out to third parties for validation. What we're able to do with our technology is instantaneously identify the oral health status within a CT and also write the radiology report.
Yeah, this is amazing that this is happening now, kind of in our phase of the career. I'd like to bring, yeah, let's bring us back to the X-rays for just a second, because some listeners have maybe never even seen Pearl, never even seen like AI enabled radiology or radiography. So what this is we're taking our normal X-rays. We don't have extra steps. We're not changing our workflow. We're not using like new logins for new steps. So we're literally just doing what we've always done clinically. We're taking X-rays, but Pearl is reading those X-rays with a high degree of learning and accuracy, is highlighting things that may be existing on those X-rays for the clinician to look at and approve or adjust, right? And so the result of that, I'm going to ask you now, okay, compared to not using AI versus using AI, what percent of treatment are we now finding with when AI helps us compared to we were not finding it before?
Well, we make this just very easy to quantify. So we have a tool set called Practice Intelligence that's paired with Second Opinion, which is the radiologic AI capability. And with this tool set, what you're able to do is select a historic period of time, say the last 3 months of activity. You could be a solo practice, you could be an enterprise, or whatever you want to throw into that query. And we will break down for you all of the missed opportunity over that period of time at the level of the treatment type per your fee schedule. We just show you, hey, the last 3 months, you just missed, $2 million of opportunity. And you also are not issuing preventative care to patients or attending to things early on. We just fully quantify it. But what's interesting about Pearl is it's one thing to understand that historically and understand where practices are proficient and deficient. It's another thing when you're able to look into the future state. So we basically also look into the schedule. We say, okay, here's your next month of activity on the for the practice, and here's the oral status and action opportunities for every single patient. And we prepare the practice on a day-to-day basis, on a week-to-week basis, as well as management teams to understand what is coming in. So you can provide very active training and just be completely explicit about the effective, we'll call it ROI, that manifests from a tool set like this because it's all there in black and white.
Yeah, what's interesting is like when you onboard Pearl, or integrate into a practice, you've got all this dirty data from the past that's not completely accurate that Pearl's highlighting. But there comes a point where every patient you see moving forward in the future is a Pearl-enabled experience, and we're always seeing all the opportunities that are there, and we, in essence, end up with clean, ethical, full diagnosis of the conditions that we might have missed just with our own human eyes.
That's why this is such an impactful technology. It's very, very affordable, especially relative, because you're going to treat more things because patients are accepting more, you're seeing more stuff. It's very easy to pay for. One small treatment per month pays for the tool set. But we typically see, because there's such an epidemic of underdiagnosis and a lack of case acceptance, very, very dramatic production increases for the practices that we work with. So when we say it's becoming a standard of care, it's very easy to understand why. It's just that the benefit is immense. The unburdening on the practice and the practitioner specifically is immense, and it just becomes a better way to do dentistry.
Well, I think that there's an ethical responsibility here. I mean, if my 7-year-old daughter needs a brain scan, I want AI looking at it too. If my wife needs a mammogram, I want AI looking at it too. That is where we are today, right? That is, in my opinion, we're already at the standard of care issue. But in addition to that, the patient's experience of this is also impacted positively. It's something I lecture on, where we can utilize Pearl on the X-ray side to dramatically increase patient acceptance of treatment, especially in these extreme situations where like a young dentist buys a practice from an older dentist who is kind of winding down dentistry and all this stuff is left undiagnosed. That younger
Yeah.
dentist coming in with Pearl now has data, now has science.
And let's be honest, there is a lack of trust somewhat on the part of the patient as it relates to the dentist diagnosis, especially when things start to get expensive. So we've run a number of surveys, there's a number of public surveys that can be looked up that we haven't run as well. It's roughly 60% of people don't trust the diagnosis that they are receiving, and that compels them to want to get a second opinion or to be a little bit more iffy about what they're going to accept or not. But when you're able to show a patient their anatomy color coded, so it's broken down by all the parts of the oral anatomy, and then how the pathology is interacting with that anatomy, it becomes a very different conversation, because you see a big pink dot that represents, say, advanced caries, and you see that it's getting close to the nerve, and you can say, hey, look, you have this amount of time, a millimeter of time. When these two things touch, you need a root canal. And now when you take the AI off and you show it to them, they see the dark spot and they see the root, and it just kind of brings it all into focus and understanding. And I think when you're able to communicate clearly, honestly, and transparently, especially with the assistance of a third-party technology, it just significantly elevates trust.
That'll be the first time a patient actually truly understands what's going on.
Yes, that's a joke that we have, is that our patients never understood. It's a bunch of gray smudges that are just very difficult to understand to an untrained eye, right?
Yeah, so I want to kind of go through the impact here. Once we have clear, honest, clean assessment of X-rays to the point the payers rely on it and believe it, that leads us to getting paid more often with theoretically no extra work. That leads to this domino effect happening, where the traditional way of having to verify insurance kind of even goes away, because we end up with real-time adjudication. That also ends up with less manual work charting. If we have less manual work charting, we have less inaccuracies. We also have more time for conversation with the patient. It also it keeps what you said, the data set pristine. So a big problem in dentistry is that, while we try to put everything in our practice management software, the kind of the storage facility of all the data, we're putting it in dirty, and therefore it's hard to get clean functionality out of it with third-party software programs. If we can input the data either with an AI agent, or some sort of automation, it keeps it clean. Then we have the full power of automation and of AI after that to properly understand what's happening and to get paid every dime we should get paid, to basically take away erosion, right? Did I describe that the way you would?
Yeah, absolutely. And we only touched on a small fraction of the automations that we provide. Another automation that we provide, which is often not even understood that it's Pearl powering this, is Scribe. So we'll do ambient listening in the operatory. We'll generate clinical notes for the practice. One of the unique features of Pearl in our go-to-market approach is that we take a highly integrated approach, because we don't want to change workflows, or we want to minimize the change management that's necessary. So we have integrated our capabilities into 35 practice management and imaging systems, so that you literally are doing what you did yesterday, but now when you open your interface, you have AI. And you also have all these other automations built into that reality. So we also offer standalone tool sets, but wherever possible, and generally this is increasingly possible, almost everywhere, we're able to put it into your existing workflows.
Well, as we wrap this up, I want to do something I've never even thought about doing, but I want to go ahead and do it right now. And I want you to fill in any sort of blanks I've missed. But I'm going to do my best to kind of describe Pearl when it comes to what happens in the trenches of a dental practice in the middle of the day, right? So in my practice, maybe I have a couple associates. So one issue, my associates aren't diagnosing enough dentistry compared to what people need. Pearl helps assist with that. Another issue, my hygienists don't seem to take a lot of time to talk to patients about what they need because maybe they're not even sure of everything they need. Pearl assists with that. Another issue, patients may not believe my associates or may not believe my hygienists that they need the work, especially because their last dentist never said they need it. Pearl assists with that. Then another issue, my hygienists don't have enough time to talk about preventative or perio or cosmetic or facial aesthetics. Well, Pearl is able to take care of a lot of the charting and things like that. That saves 5 or 10 minutes in that every single recall appointment. Now we can add that time or add like a scan. Pearl solves that, right? Then I've got people on hold for 45 minutes dealing with insurance verification. Pearl will solve that. I've got issues with insurance companies not, paying my claim. No, Pearl solves that. I may even get not just real-time adjudication, I might get real-time payment as a result of that.
Correct.
And so this becomes, when you say radiology is your keystone technology, I might say in similar terms, Pearl is dentistry's keystone technology. But because this really is chapter 1 of the next book of innovative dentistry, especially business management. So this is an insanely important moment, I think, in the timeline of dentistry, and you guys have been on the forefront of it. And thank God. Thank God that that's happening now in a provider-centric way. I would much rather have you guys helping us get paid than you guys helping the insurance companies not have to pay. Right? So thank God that you guys are focused on the provider side and on making sure the team doesn't have to add a bunch of steps, that we can just keep taking care of patients as we know how, but now it is being tech-enabled, AI-assisted. It is basically supported with this new wave that Pearl represents.
Yeah.
Did I say all of that correctly, or did I miss anything?
Yeah. I mean, if you want a job, call me. You're just like very good. You're very good at summarizing the value proposition here. Look, we are, as you mentioned, an extremely provider and practice friendly organization. And that has always been our philosophy and intention. If you think about it, dentists are just wildly burdened. They have to manage very complicated work lives, right? They have to run a practice and manage the financials and manage staffing and communicate with patients and issue treatment and deal with vendors and all this stuff. So what are the things that AI, can't do and it won't do, at least in the near term, right? It empathize with patients, communicate clearly with patients, actually issue the treatment itself, right? We're trying to unburden practitioners so that they have more time to do that very human stuff and the actual, hands and mouth and tools and mouth activity just better and more comprehensively.
It's always in the past been a fantasy that I, the dentist, can show up and I treatment plan everything someone needs, and the patient understands and values it. And my team is just focused on that, and we get paid, and we don't have all this other noise. That fantasy is now slowly but surely, I shouldn't even say slowly, it's been slowly. Now it's speeding up. It's becoming a reality. And this is, I don't want this podcast to be some Pearl commercial, although I'm sure you appreciate that. But this is really the best way for me to kind of communicate to the world, like, hey guys, like this is what's happening. And we've got to have our eyes and ears open and be part of this. We got to jump on this wave. Go grab your surfboard, go implement something like Pearl, and let's hop on this wave together, because this is finally solving some really difficult problems that we've always, had trauma from in the past.
Yeah, if you're practitioners, you know this better than me. I mean, most dentists love practicing dentistry. They just don't love all the other stuff that comes with having to run a business effectively, because it's hard and it's distracting. It's not what they were trained for. And they want to do good work and provide value to patients in a very fundamental and important way. And I think that's a great characterization, is that we enable that to happen in a much more effective and comfortable manner. And, we're not here trying to increase production. We're here trying to institute a higher level of truth. It turns out that because of the reality of dentistry today, it does result in very significant production increases, which is a great feature. It's a great feature of Pearl, I'm not going to lie, because if we're able to generate lots of revenue, it makes people even more eager to engage in the tool set. But we're just letting the truth sort of speak for itself. And again, we're surfacing so much more disease that goes undiagnosed, and adding such significant layers of efficiency and communication ability, that if you just kind of follow the very simple playbook and protocol and leverage the tool set, even just second opinion on its own without anything else, you're going to see significant benefit.
Well, if oncologists missed cancer 1/3 the time, and we had a tool to make sure that that problem went away, of course, it's only about patient
Yeah.
care.
And we increasingly have those tools in all forms of medicine. Pearl is very focused on maxillofacial and dental, of course, but there are other companies that are focused on pretty much every form of radiography. And that's, I think, to your point, very much to the good. As a patient, I would want a diagnosis to be bolstered by AI.
Well, a lot of companies, you said something that maybe for the first time in my career, I think you deserve to say it. You can say it, but everyone else says it too, and it's bullshit. It's bullshit when they say it. DSOs tell dentists, we're going to take care of the business side so you can focus on what you like best, the clinical side, right? Other vendors with their products and services, even supply companies are saying like, we're going to take care of this so you can do what you like best. The reality is hardly any of those solutions actually enable a dentist to truly focus more on the clinical side and the team to take better care of patients. They're just kind of manipulating the message. And on top of that, a whole lot of dentists are burnt out from the dentistry, but I don't think it's from the dentistry. I think they're burnt out from having to do dentistry in this chaotic, noisy war zone of a dental practice, right? And they're just frustrated that they can't just show up, see a few patients a day, take home great money, do really good care for people, and people want to work there, right? So you maybe have been the first person to have said, we're going to help you take care of this side so you can focus on dentistry. And you're literally probably the first person that I actually think deserves the shot at saying that. Everyone else doesn't, in my opinion.
I really appreciate that very much. We don't obviously do everything. We're not going to solve your staffing challenges. Those will continue to be real challenge, right? So, but I do think that net cost versus benefit, this is just a tremendous level up, this technology for the industry. And it has all these additional benefits that you mentioned. And very importantly, returning a sense of happiness, delight to the practice of dentistry, which I completely agree with you. The burnout doesn't come from the dentistry itself in general.
Yeah, and dentists listening to this, like anything, the practice you have today, if that's not what you want tomorrow, it's going to take work to change it. It's going to take integrating a new software. It's going to take understanding how to have that integrate with how you currently see patients. Sometimes you've got to change some things. Obviously, Pearl is trying to minimize disruption, but the reality is for you to be the practice tomorrow, you're going to have to change what you do, and you're going to have to disrupt a few things. And I think we're finally in a path with technology where tech-enabled changes in a practice can happen quickly and effectively. We got to wrap this up. Ophir Tanz, is there any last thing you want to say before I kind of let people know how to get a hold of you and finish out this episode?
No, look, I think it's an extremely exciting moment. I've run a few companies and I've applied this technology to a number of different industries. This is by far and away the most gratifying application, computer vision. I feel like we're affecting real lives on a day-to-day basis, both patients and practitioners and office staff. And we're also very committed to the long-term value here. So we're very much focused on building what will ideally become a transformational legacy company in the category. And, this overarching goal and philosophy of just making dentistry better and unburdening our customers and driving better oral health outcomes, I think is entering a very exciting phase. And we're going to see a lot of development over the next 2 to 5 years.
Awesome. Well, I cannot thank you enough for putting in time from what I'm sure is a very busy day for you to speak to us and our audience. If someone wants to connect with you or your company, where would they go?
So hellopearl.com is the URL. We invite you to visit the website and learn more and reach out. Folks can reach out to me directly. I'm Ophir at hellopearl.com. Happy to, I'm often a little bit slow on emails. There's a quantum of it, but I'm very happy to receive outreach. And yeah, we have a great company. We have a great clinical staff, and just a team of very, very committed folks.
And let me
Again, yeah.
say, like global. I mean, we're not talking about U.S. and Canada, but you guys are supporting dentists all over the world now in these changes. Is that correct?
Yeah. Yes, we're technically regulatorily able to operate in 120 countries. So we've taken a very global approach since day one. America and the US has always been sort of the leader of the pack and the key area of focus. And there's a lot of reasons for that. Obviously, we're based here, and it's a very functional, forward-looking market. But it's also easier to do more advanced work in a country like America. So we do a lot in the UK, for example. In the UK, there's not standardized treatment codes. That very much limits the kind of value that you can add in a market like that from an automation and analytics perspective. That's not necessarily the case in other countries, but yes, in general, we are actively operating in most of the developed world.
Okay, awesome. Well, we need to wrap this up. Everyone, I hope you guys listening to this learned a lot about not just, of course, Pearl and where things are at today, but really what the vision of the future dental office actually looks like, the different colors and layers to that with claims and verification, charting and automated treatment planning and so forth. This was a really cool episode. In a time when there's not a lot of people sharing real information so readily. So Ophir, thank you so much for like doing that and just opening up your vision and your plans so that the rest of dentistry can learn from you and see where we're going. Those of y'all listening, please subscribe, please comment, help us out and support us as we continue to try to support dentistry with more episodes like this. I want to thank everyone again for listening in. And Ophir, I want to thank you again for your time. And let's wrap this up. My name is Scott Leune, and this was the Dental CEO Podcast. Thank you.